Pop quiz. It's Dr. Hart again. I have one more pop quiz on psychopharmacology for you today. This is just 3 questions, real quick, on the psychopharmacology content that I posted. So take a look at that, check that out, and then you can do these practice questions. Don't forget to like and subscribe and share my YouTube channel, Nursing with Hart PhD. I'm on TikTok and Instagram as well. So let's get right into it. I'm going to help you answer these test questions on psychopharmacology. This is good for your NCLEX practice, your mental health exams, your benchmarks, Lippincott, HESI, ATI. And this will help you practice these concepts on mental health and psych meds. All right, let's go. Number 1, a client was recently admitted to the inpatient unit after a suicide attempt and has not responded to SSRIs or tricyclic antidepressants. The client asked the nurse, I heard about MAOIs, monoamine oxidase inhibitors. Why can't they be added to what I am on now? Which is the most appropriate nursing response? Okay, so this is patient education here, very important on the psych meds, specifically SSRIs or tricyclic, the 2 different types of antidepressants that I covered in my lecture content video. So the client wants to add MAOIs, and why can't I add that? Okay, so the nurse needs to educate the patient on why SSRIs or tricyclics should not be combined with MAOIs. Let's look at the answer choices. Letter A, electroconvulsive therapy, ECT, is your best option at this point. I will have a video posted very soon on electroconvulsive therapy or ECT. Letter B, combined use can lead to a life-threatening condition called a hypertensive crisis. C, there is no reason why an MAOI couldn't be added to your therapy. Or D, they can't be used together because their mechanisms of action are very different. So I'll give you a minute on this one to think about this, and we'll come back. Okay, so on this one, the correct answer is letter B as in boy. Combined use can lead to a life-threatening condition called a hypertensive crisis. I've talked about this in my lecture video on combining SSRIs or tricyclics with MAOIs or monoamine oxidase inhibitors. Okay, a combination of these medications. MAOIs are also antidepressants, so adding these all together would put your patient at a great risk for a hypertensive crisis, which would be a greatly elevated high blood pressure. Okay, and so let's look at the other answer choices. Letter A, electroconvulsive therapy, ECT, is your best option at this point. So electroconvulsive therapy or ECT is for patients who have been on antidepressants and they're just not working. This is a patient who is at the point where they are not responding to antidepressants and they are at a high risk of committing suicide, and so the ECT is used at this point. Okay. Letter C, there's no reason why an MAOI couldn't be added to your therapy. That is not true. That should not be added because of the risk of a hypertensive crisis. And D, they can't be used together because the mechanisms of action are very different. That is not why they should not be used together. Okay, it's because of the risk of hypertensive crisis. Let's look at the next one. A client began taking lithium for the treatment of bipolar disorder approximately 1 month ago and asks why he has gained 12 pounds since then. What is the most appropriate nursing response? Letter A, I'm surprised you've gained. Weight loss is the typical pattern when taking lithium. B, your weight gain is more likely related to food intake than medication. C, weight gain is a common but troubling side effect. Let's talk about some strategies for safely improving your nutrition and exercise habits. Or D, there's not much you can do about the weight gain. It's better than being emotionally unstable, though. All right, so think about these answer choices and we'll come back. Let me know which one you think is the correct answer. You can always put it in the comments also for any of these, which one you think is the correct answer, and I will give you a timely response. Okay, let's come back to this one, and the correct answer is letter C. Weight gain is a common but troubling side effect. Let's talk about some strategies for safely improving your nutrition and exercise habits. This is another important patient education question on your patient who is taking lithium. Okay, lithium has a lot of concerns. One of them is weight gain, possible weight gain. It is a common and expected side effect, but it is troubling and it is the reason why some patients will stop taking the medication because of weight gain. So the nurse is educating the patient that weight gain is common. It is a troubling side effect, and the nurse is offering some strategies for safely improving their patients' nutrition and exercise habits. So you can suggest low-calorie, low-fat foods. You can talk to your patient about walking, bicycling, swimming, whatever activities they can physically tolerate and what activities they enjoy. Let's look at these other answer choices. Letter A, I'm surprised you have gained. Weight loss is the typical pattern when taking lithium, and that is incorrect. Okay, it is weight gain. Letter B, your weight gain is more likely related to food intake than medication, and that is incorrect. It's not related to food intake as much as it is the lithium. In letter D, there's not much you can do about the weight gain. It's better than being emotionally unstable, though. Let's talk about this one in therapeutic communication. Okay, this is not a therapeutic communication style. This is not this is not a positive therapeutic statement. This would be considered a negative therapeutic statement. Okay, kind of sarcastic, right? It's better than being emotionally unstable. And that is truly disregarding the patient's feelings. So that is non-therapeutic communication, letter D. So that is definitely incorrect. All right, let's look at the last one. The nurse is assessing a client who has a diagnosis of schizophrenia and takes an antipsychotic agent daily. Which finding requires further nursing assessment? Okay, this is a good assessment question. And here's where you have to know the signs and symptoms of antipsychotic medications. Okay, what are the risks involved? This is an assessment question for the nurse. Here are your answer choices. Letter A, respirations of 22 beats per minute. B, weight gain of 8 pounds in 2 months. C, temperature of 101. Or D, excess salivation. All right, I'll give you a minute to think about this one. All right, let's go back to this one, this last question for this quiz number 2 on psychopharmacology. All right, so the correct answer is letter C. Okay, temperature of 101. And these are the antipsychotics that I talked about. The example I gave was clozapine, brand name Clozaril. Clozapine was the example of an antipsychotic that may cause agranulocytosis. You must know that. Okay? Temperature of 101 is going to be sign of an infection. And why is the patient at risk for infection? Okay, because of the possible low white blood cell count caused by the antipsychotics. Okay, an elevated body temperature is a sign of an infectious process going on. Clients taking antipsychotic medications may acquire agranulocytosis, which is characterized by a significant decrease in the white blood cell count and reduced immunity. Okay, antipsychotic medications can also cause weight gain and excess salivation. Okay, but the priority here is to assess for the agranulocytosis because of the elevated temperature, 101. Okay, and that's it for this one. Just a few questions, and look out for the next one. We'll see you on the next go around. I'm going to do some probably tomorrow in the next couple of days. So we'll see you then. Have a great day.